Yeah, so this is a study evaluating a chemotherapy-free regimen of Blinatumomab in combination with Ponatinib in patients with Ph-positive ALL. And so we are enrolling any adult patient with either newly diagnosed or relapsed refractory ALL. There's a lot of interest in these chemotherapy-free regimens in this disease. Obviously, Ponatinib is a very potent TKI. Blinatumomab is very effective in the relapsed refractory setting. And there's some good early data for Dasatinib and Blinatumomab in newly diagnosed AML. And so that was kind of the rationale for combining these, particularly with the ability for Ponatinib to target and treat being active against T315I mutations, which we know cause resistance to other types of TKIs. So in this study, we give patients 5 cycles of Blinatumomab in combination with Ponatinib. The Ponatinib is initially started at 30 milligrams daily and then decreased to 15 milligrams once patients achieve a complete molecular response. Those are given in combination again for the 5 cycles, and then patients receive 5 years of Ponatinib maintenance at 15 milligrams daily. They also receive 12 doses of intrathecal chemotherapy. And so far, we've treated 35 patients overall, 20 in the frontline setting, 10 relapsed refractory, and then we also included patients with CML and lymphoid blast phase because these behave similarly to Ph-positive ALL. And so overall, the response, I think the data have been very encouraging. All but one patient have responded to the regimen. There was one patient with multiply relapsed refractory disease. So among the frontline cohort of 20 patients, all of them achieved a remission, 85% of which achieved a complete molecular response. In the relapsed refractory setting, 89% achieved a response, and among the responders, 88% achieved a complete molecular response. And so in the frontline setting, these responses translated to a 2-year estimated overall survival of 93%. Notably, only one patient died. This is a patient who died actually in remission. So there have been no relapses in the frontline setting, and also no patients have undergone stem cell transplant. In the relapsed refractory setting, the 2-year event-free survival is 41%, 2-year overall survival 53%. And overall toxicity is as expected with both drugs. No patients had to stop therapy due to Blinatumomab. There were 2 patients who had to who came off study one due to stroke, one due to development of a DVT. But overall, we believe these data are very encouraging, particularly in the frontline setting where we had a 100% response rate, 85% complete molecular remission rate, no patients relapsing, and none of whom were transplanted. So overall, I think that this potentially represents a very promising chemotherapy-free and transplant-sparing regimen for patients with Ph-positive ALL.